An online ADHD quiz takes 5 minutes. A true adult ADHD evaluation takes several hours. That gap is not because evaluation is slow or inefficient. It's because the two are doing fundamentally different things. An online quiz looks at a pattern of self-reported symptoms and tells you whether your answers are consistent with ADHD. A true clinical evaluation asks different questions. Does ADHD actually fit your clinical picture? Could something else explain the symptoms better? Is ADHD present alongside other conditions? And how does your specific brain function in ways that matters for treatment? In the United States, APSARD has been developing the first adult ADHD guidelines precisely because adult ADHD assessment varies widely across clinicians and settings. That variation is one reason it helps to know what a good evaluation should include before you walk into one. In this video, I'll walk you through what an adult ADHD evaluation measures, the components and the order they typically happen, why differential diagnosis matters more than most online content acknowledges, and what online quizzes can and cannot tell you. By the end, you should know what to expect from a competent evaluation and what questions to ask any clinician you are considering. Now, before I go further, let me clarify a couple of things. This is educational content, not a substitute for clinical evaluation, diagnosis, therapy, medication management, or treatment. And evaluations vary by clinician and setting, so what I describe here reflects general best practices, but the specific instruments and structure your evaluator uses might differ. Variation does not automatically mean inadequate. The key is whether the evaluation covers the essential components I am about to walk through. The most common misconception about ADHD evaluation is that it is a test that produces a simple yes or no answer. It's not quite like that. An evaluation is a comprehensive clinical formulation. That means it establishes several things at the same time, and the diagnosis, if one applies, is just one output among several. A good adult ADHD evaluation establishes the following. First, whether your symptom pattern meets diagnostic criteria for ADHD. The DSM-5-TR, which is the current diagnostic manual in my field, requires at least 5 symptoms of inattention or hyperactivity impulsivity for adults ages 17 and older. Second, whether those symptoms have been present since childhood. Adult ADHD is understood as the continuation of a developmental condition that began before age 12. The timeline matters, and a good evaluation will explore it carefully. Third, whether the symptoms cause meaningful functional challenges across multiple settings, not just one setting like work, but across work, home, relationships, and self-management. Fourth, whether other conditions might better explain what you're experiencing. This is called differential diagnosis, and I'm going to spend a full section on it because it's one of the most important and underexplained parts of evaluation. Fifth, whether other conditions are present alongside ADHD. Co-occurring conditions are common, and a good evaluation identifies them because they matter for treatment planning. And sixth, your specific cognitive and functional profile, your strengths, challenges, the pattern of how your brain actually works. This profile often matters as much as the diagnosis itself. I also want to name something before we get too procedural. For many adults, seeking an ADHD evaluation is not just a paperwork step. It can feel like you're trying to prove a lifetime of invisible struggle. A good evaluation should not make you feel interrogated or dismissed. It should help organize the evidence clearly enough that your experience finally makes clinical sense. The diagnosis is not the destination. The formulation is. That distinction is what makes a real evaluation different from a quiz. A typical adult ADHD evaluation includes several components, and often in this sequence. First, the clinical interview. This is the foundation of the evaluation and usually the longest single component. The clinician will ask you about your current symptoms, developmental history, academic history, work history, relationships, and virtually everything else like sleep, medical history, family history, emotional functioning, and daily functioning across multiple domains. The interview is where much of the diagnostic information actually lives. A clinician who skips a thorough interview is skipping the core of the evaluation. Second, standardized self-report measures. These are validated questionnaires that quantify your symptom patterns and compare them to established clinical or normative data. The Conners family of rating scales is one widely used example, though specific instruments vary by clinician. These measures are useful. They provide standardized comparison data, but they do not replace the clinical interview, and they cannot diagnose ADHD on their own. Third, collateral information when available and clinically appropriate. Collateral information means input from someone who knows you well, a partner, parent, sibling, longtime close friend who has observed your functioning across time or settings. ADHD symptoms in adults are often patterns the person has normalized or stopped noticing, but other people may observe clearly. Collateral information might be a structured conversation or parallel rating scale that they complete in the evaluation. Collateral information can add significant value, especially when self-report and observed behavior do not fully line up. At the same time, not everyone has a safe, reliable, or appropriate collateral informant, and that should be handled thoughtfully, not rigidly. Fourth, cognitive testing when included. This may involve specific tests of attention, processing speed, and executive function, among other domains. Many also include continuous performance tests to see how your brain performs in certain tasks over time. Important clinical point: cognitive testing does not diagnose ADHD by itself. People with ADHD can perform very well on cognitive testing, and people without it can perform relatively poorly. Cognitive testing can add useful information, especially when there are questions about learning, memory, or conditions like brain injuries. But cognitive testing is not required in every ADHD evaluation and is not a diagnostic ADHD test. Fifth, differential diagnosis. This step is important enough that I'm giving it its own section next. And finally, integration and clinical formulation. The clinician synthesizes everything: the interview, standardized measures, collateral information when available, cognitive testing, and the differential considerations. The output is a comprehensive picture: diagnosis if applicable, alternative explanations considered, co-occurring conditions identified, cognitive and functional profile described, and treatment recommendations specific to you. I want to say this clearly: no single test diagnoses ADHD. The diagnosis comes from clinical integration of multiple methods and sources. That's the entire reason evaluations take the time that they do. Differential diagnosis is one of the most underexplained parts of ADHD evaluation in popular content, and in my clinical experience is one of the most important. The plain language version is this: differential diagnosis means systematically asking what else could explain what you're experiencing before concluding that ADHD is the answer. Several conditions can produce symptoms that look a lot like ADHD. A 2025 review in World Psychiatry led by Cortese and a group of leading ADHD researchers addressed this directly. The review identifies several conditions that must be considered or ruled out before concluding that ADHD is the answer. Sleep disorders like insomnia and sleep apnea, thyroid dysfunction, traumatic brain injury, medication side effects, chronic stress, anxiety, depression, and post-traumatic stress can all produce attention and executive function problems that resemble ADHD. These conditions matter because some can mimic ADHD and some frequently co-occur with ADHD. A good evaluation distinguishes between those scenarios. In my experience evaluating adults, the patients who arrive expecting a quick yes or no on ADHD are often surprised when the evaluation reveals a more complex picture. Sometimes ADHD is clearly present, but a co-occurring condition is the more urgent treatment priority. Sometimes a sleep disorder or substance use is producing much of the attention problem, and ADHD is not the primary issue. Sometimes someone has been managing untreated anxiety for years, and the anxiety has been generating cognitive symptoms that look like inattention. That kind of clinical nuance is exactly what online quizzes cannot produce. A quiz asks you to rate symptoms, which can be biased towards preference, whether conscious or not. It cannot independently determine whether something else is causing those symptoms. If you pursue an evaluation, one specific question that signals clinical sophistication, ask your evaluator how differential diagnosis will be handled. A competent clinician should have a clear answer. That single question tells you a lot about the quality of the evaluation that you're walking into. Now to the question many people start with. What can online ADHD quizzes actually tell you? Online quizzes can support useful pattern recognition. If your responses to a validated screening instrument are consistent with adults who have ADHD, that is meaningful information. It is a reasonable starting signal that suggests an evaluation might be worth pursuing. For many adults, a screening tool is the first time they see their experiences organized into a pattern, and that can matter. But here's what online quizzes cannot do. They cannot establish that your symptoms began in childhood and continued over time. They cannot rule out other conditions. They cannot evaluate functional impairment systematically. They cannot integrate collateral information from people who know you well. And they cannot produce a comprehensive clinical formulation. The same 2025 World Psychiatry Review identified the lack of validated and objective diagnostic measures for adult ADHD as one of the ongoing controversies in the field. No single tool, online or in person, can substitute for a comprehensive clinical assessment. Even validated screeners like the Adult ADHD Self-Report Scale are designed as screening tools, not diagnostic ones. They flag the possibility of ADHD, but not establish it. The honest takeaway is this. If a quiz suggested you might have ADHD, take that seriously as a reason to pursue a true evaluation, not as a substitute for one. Pattern recognition got you through the door. What's behind the door is what an evaluation establishes. If you decide to pursue an evaluation, here's what to look for. The consensus is not that every evaluation must look identical, but that certain core elements matter. Look for clinicians whose practice specifically includes adult ADHD assessment. Not just child ADHD and not just general mental health. Adult ADHD has its own considerations and not every clinician is current on it. Ask how long the evaluation takes. A 30-minute single appointment is rarely sufficient for a comprehensive adult ADHD evaluation. The exact length varies, but expect several hours of evaluation time, often spread across more than one visit. Ask which methods are included. A competent evaluation uses multiple methods: clinical interview, standardized measures, differential diagnosis, and when appropriate, collateral information and cognitive testing. If an evaluator describes the process as a single questionnaire or a brief conversation, that is not a comprehensive evaluation. Ask how differential diagnosis will be handled. That question alone signals clinical sophistication on your part and gives you useful information about the evaluation's thoroughness. Ask whether collateral information will be gathered and what happens if a safe or reliable collateral informant is not available. Cost and insurance coverage vary widely. Some evaluations are covered by insurance and some are not. CHADD and ADDA both maintain resources for ADHD education, community support, and finding ADHD-informed clinicians. Their websites are chadd.org and add.org, respectively. Let me bring this back to where we started. An online ADHD quiz takes 5 minutes. A real evaluation takes several hours. The reason for that gap is not inefficiency. It's that a quiz and an evaluation are doing fundamentally different things. A quiz looks at a pattern and tells you whether it resembles ADHD. An evaluation establishes whether ADHD actually fits, what else might be happening, and how your brain works in ways that matters for treatment. If you have wondered whether you might have ADHD, an evaluation is the way to find out, and now you know what to expect if you pursue one. If you want a starting point for understanding your own cognitive patterns while you consider evaluation, the free Module 1 sample of the Brain Protocol walks through the foundational concepts about ADHD, cognition, and meaningful change. The link is in the description. The next video covers something personal to me. My identical twin brother also has ADHD, and what the research now tells us about how ADHD is inherited. We will look at twin studies, newer genetic findings, and what family heritability does and does not mean for individual children. If you want more ADHD content, subscribe. Take care, and I will see you in the next one.